on a mask or to undergo an intubation. Hi and welcome to my first ever episode on Ray Talks, where I'll be discussing medical and health topics, and for today I will be talking about what you don't know about COVID-19.
And although it's not in her.
At first, I'm a biomedical student and I am involved in coronavirus campaign, basic life support campaign, and lastly I'm involved in food safety campaign. Now, let's dig in. What is an intubation? An intubation, it's a procedure performed by the doctor, and it's basically a tube inserted into the throat of a person suffering from shortness of breath or other respiratory diseases. Now, I'm not here to talk about what the general know about COVID-19. I'm here to talk about what we don't know about COVID-19, which is the symptoms, 6 symptoms: flu with fever, flu without fever, gastrointestinal. It targets specifically the gastrointestinal. Now we've got the one, severity type 1, severity type 2, and lastly severity type 3, which involves pneumonia, sometimes death, and kidney failure. I've spoke about these a lot on my website. It's for the people who would know more about the symptoms, details, and all about that. Who does it affect? Now we know that it affects people who have underlying medical conditions, people who are 60 and above, and people who are severely obese, and people who are weakened immunity, obviously. But the question is, how do you know if you've got good immunity or not? Now, we've got the risk factors that actually triggers our immunity, which is lack of sleep, anxiety, stress, lack of vitamin D, fast food, which we have embedded fat inside it, and lastly, smoking. Smoking affects our air sacs, and in a very severe way that the oxygen is not distributed into our body in the perfect amount. Now, this is how we know we've got a lot of risk factors that actually affect our immunity. The misconception of COVID-19. Now we've got 3 misconceptions of COVID-19. Number 1, the percentage of COVID-19 spreading through my shoes is less likely than the percentage of me living here. So let's not stress about that. Number 2, the usage of masks. The usage of masks does not lead to CO2 intoxication, nor does it lead to oxygen deficiency. What the mask does, it filters out the polluted air we breathe in. Number 3, the false diagnosis tool, as I call it. The false diagnosis tool is, as you all know it, is the one that when you close your nose for 10 seconds and then you breathe out and you don't feel any kind of discomfort in your chest area, which means you have no infection or no virus. This is not true. I really want to meet the person who invented this thing. I have to meet. I want to discuss stuff with them. The alternative treatments. Now we've got few alternative treatments going on, obviously, but none of them are existing in Lebanon, obviously. One of the treatments that are actually fascinating is the convalescent plasma treatment, which is basically the antibodies taken from a person or the patient who survived the COVID-19 and is given to someone who is currently affected by the COVID-19 and has severe case. So this was beneficial to some people, and unfortunately it was not beneficial to other people. So it's still in clinical studies and it's still going on. I've actually published a blog about the convalescent plasma treatment, which is for the people who would like to dive in the details. Lastly, I would like to say that this virus is staying for probably months or years. So let's take precaution and let's make sure when we're out there that we're not transmitting the virus, nor are we getting it. Thank you for watching. Stay healthy and stay safe. What was the intro? Hi and welcome to my first ever episode on Ray Talks, where I was discussing. I've actually published a blog about convalescent plasma treatment, which is for the people who would like to dive in the details. One of the treatments